Hello, my dear friend. Today in this session, we are going to discuss the important topic of FMGE exam, MCI exam. And we are going to discuss the important topic in the sequence in which it come in the exam. Okay? Like the most important, most frequently asked topic should start with one. And that is the health system of India they ask from. Okay? Most important topic which I have found in my last 6-year exam pattern when I check for PSM. Most important area is health system of India. Of course, from health system of India, they start asking question regarding ASHA. Okay. Please remember कि still there is only one ASHA per 1,000. Then they discuss the work of ASHA and work of Anganwadi worker, they ask it. In the recent exam, they have asked the eligibility criteria for selecting ASHA. So the criteria is that she should be minimum 8th class pass. Okay, 10th class is what we prefer, but minimum 8th class pass is the criteria. And select the person who select ASHA is Gram Panchayat. ASHA do not get any monthly salary, fixed monthly salary. She get paid according to the work, and she get 23-day training by ANM present at sub center or medical officer in charge present at PHC, and so they will give the training. Remember that ASHA and Anganwadi both do not do 3 work. They both of them, ASHA and Anganwadi, don't make malaria slide, they don't conduct delivery, and they don't give vaccine theoretically. Practically, when you will visit village, you will find that ASHA and Anganwadi are the one who are giving vaccine. But theoretically, they don't do these 3 things. Don't conduct delivery and don't give vaccine theoretically. Okay? And this is a very common question that who make malaria slide then? So it is the health worker male, which is also known as multi-purpose worker, who make malaria slide, and he make malaria slide by active surveillance. Active surveillance means health worker will visit the house of all the villagers and they will search for hidden cases. And they will take 2 blood film, thin and thick. In the thin blood film, you can appreciate the gametocytes of Plasmodium falciparum, which will be banana-shaped gametocyte, and if the gametocyte is of Plasmodium vivax, the gametocyte will be circular and rugby ball shaped. So like this is the RBC. They can give an image based question from here. Banana shaped gametocyte falciparum, and for vivax we have rugby ball shaped, this type of gametocyte. Okay. Now, after asking from this part that what are not the work, they can ask the work of ASHA, which you have to remember. You can remember it on your finger right now. First work is that ASHA distribute condom, OCP, all the normal treatment medicines. Second is ASHA assist mother during delivery. Don't conduct delivery but help mother in delivery. And ASHA took ANC mother, pregnant mother for 4 ANC checkup. The minimum number of ANC visit is 4. WHO says 8, but in India it is 4. Third point which ASHA does is act as DOT provider. DOT means of course directly observed treatment short course, and it is given for TB and leprosy both. The fourth work which ASHA does is home based postnatal care, and this home based postnatal care is done 4 visit if there is home delivery. After delivery, ASHA visit the home of mother and she look for 3 things: whether the breastfeeding is adequate or not, whether the fever is there in mother or child or not, and whether there is excessive pervaginal bleeding in the mother or not. So if she find any problem, she can treat or she can refer. So if ask about home-based postnatal care visit, it is 0, 3, 7 and 42. 4 visit if it is home delivery, and if it is hospital delivery, there is 3 visit. Okay. Why 3 visit for hospital delivery? Because in hospital delivery, on day 0, mother will be in hospital. So whom the ASHA will visit? Sasurji and a father-in-law. There is no one to visit and check. So 3 visit for hospital, 4 for normal home delivery. If the weight of the child is more than 2.5 kg, then these are the number of visit. Okay. Other than that, ASHA evaluate whether government program is bringing any change or not. ASHA celebrate Village Nutrition Day once in a month with the help of VHSNC. This is Village Health Sanitation Nutrition Committee, which also prepare Village Health Plan. Okay, and this Village Nutrition Day is celebrated once in a month. Okay, once in a month. This is also known as Mamta Divas. And Mamta Divas is not celebrated in West Bengal. It is celebrated in Tamil Nadu, Kerala, and some part of Gujarat and all, where the health system is good. Okay, so see the love. Mamta Divas in Gujarat. Okay, so this is Village Health Sanitation Nutrition Committee, which also prepare Village Health Plan. Okay, so these are the some of the question which come from ASHA. Then you have to know about sub-center, mainly the population norm. They keep asking. It is at 3,000 population in hilly area and at 5,000 population in plain area. Similarly, when they ask about PHC, the population norm is never to be forgotten. It is 20,000 and 30,000. Of course, the lesser one is for hilly. The more one is for plain, because in plain people live close to each other, so more population. Moreover, in sub-center, you must be knowing that there are 2 type of sub-center, type A and type B. Type A don't conduct delivery, A no delivery, and if the sub-center is of type B, then they can conduct delivery. Okay, and the sub-center has usually 1 bed if there is no delivery for examining the patient, and there are 2 bed if they conduct delivery. From PHC, the second question they ask is, what are the 4 pillars? Very frequently asked question. 4 pillars of PHC. Remember this on your fingertip. First is equitable distribution. They also play with the meaning and spelling sometime. So equitable is the first. Equitable means poor people should get more facility, giving facility according to the need. Okay, like your first responsibility, if you went to a PHC as medical officer in charge, first focus should be on Harijan Mohalla, on slum area. And because in that area there is maximum poverty, malnutrition, TB, everything. So that is equitable, giving more to those who need more. Second is, second pillar is community participation. Suppose there is no road to your PHC. So you can ask the villager to contribute some money and make some road. That is community participation. But if you coordinated with transport department, suppose you talked with district magistrate to prepare road to PHC, and he talked with the transport department, and transport department is making roads in the villages and helping the PHC in improving the accessibility to villagers. So that is intersectoral coordination, because now health department and PHC are coordinating. Similarly, if you want to improve Anganwadi do not come under health ministry. Anganwadi comes under Ministry of Women and Child Development. So suppose you went as a medical officer in charge, you want to improve Anganwadi, that is intersectoral coordination, because PHC comes under Ministry of Health and Family Welfare. Anganwadi comes under Ministry of Women and Child Development. So there is intersectoral coordination there. The fourth is appropriate technology, not adequate. They have asked this question, adequate technology is a pillar or not. They have asked whether whether universal health coverage is a pillar or not. So they are not the pillar. Appropriate technology means that technology which can be used by less literate villagers also, and that is low cost also. Example of appropriate technology they can ask in the exam, that can be Sakir tape, which is used to measure mid-arm circumference, that can be WHO ORS, and that can be the pulse oximeter which we are using for COVID patient these days. Okay, so the 4 pillar they ask, and then they ask from PHC they can ask what are the test facility that are available at PHC and sub-center. So these are the point from this part. Then from CHC they can only ask the population norm. It is very simple to remember. It is 80,000 to 1 lakh in hilly area and 1 lakh to 1.2 lakh in plain area. So if you just remember that CHC should be at 1 lakh plus minus 20,000, minus 20 in hilly plus 20 in plain. Then at CHC there are 7 super specialty doctor that should be present in theory. They are not actually present, but they should be present. They ask which of the following should not be present. So if you remember the 7 who should be present, you can give the answer easily. The most important is obs and gynae. They save maximum life, not only the life of mother, but also the newly born child life is being saved by obs and gynae. Second one will be the medicine person. Third one will be the pediatrician. Fourth one will be the surgeon. Fifth one will be the anesthesiologist, because you are having the surgeon and the C-section for C-section obs and gynae. So you need anesthesiologist. The sixth one is the ophthalmologist, because at least 300 cataract surgeries should be done per 1 lakh population. So that should be there. And the last one is MD PSM. That should also be there. So these are the 7 super specialists that should be present at CHC. Okay, these are the main questions from main area of question from the health system of India. After health system of India, the second topic from which every year question definitely come is biomedical waste management. And it is very simple to remember the 4 categories, and for COVID waste you have to look separately. Okay, in biomedical waste, I think you know that the black category is for garbage, and in the black category we throw the wrappers of syringes, we throw the garbage, we throw the, let's say, the food leftover, and these things are going in black. Then black is not for biomedical waste. Biomedical start with yellow, and in yellow we have 6 examples which you can remember on your fingertip: cytotoxic drug, expired medicines, anatomical waste, microbiological waste, liquid waste, and soiled waste. Soiled means that waste which is contaminated by body fluid. For example, they have asked it, where will you throw the cotton? Cotton is a soiled waste, goes in yellow. Where will you throw the placenta? Where will you throw the N95 mask? Where will you throw the face cover, face seed, and not the face seed, but where will you throw the head cover and shoe cover? So head cover and shoe cover are made up of this material, so they all go in yellow. Then when they ask about red, PPE kit goes in red, because the guideline for biomedical COVID waste came in 2020, and at that time there was plastic PPE kit with chain, and all the things made up of plastic, rubber or tube, plastic or rubber goes in red. Okay, so PPE kit goes in red along with face seed and goggles. Okay, like this you should know. In blue we have only 2 things in blue. One are all the instruments and implant, and other is the glasses. They have asked it in one of the MCI exam, where will you which category of waste are incinerated? Answer is yellow. Yellow category goes directly into incineration, where we burn it. Okay, and blue category have instrument and glasses and implant, so we sterilize them and reuse the instrument and implant, and we can recycle the glasses. The fourth and last is the white, where we have only 4 examples. One is the scalpel, because the scalpel which we have is not the big one. It has a surgical blade on it, and if you try to remove surgical blade, it can cause the tissue damage. So that's why scalpel goes there. Okay, scalpel, surgical blade, then the needles, whether it can be suture needle or it can be normal needle, it all goes in white. Okay, needles are of 2 types, suture and injection needle. Okay, so These are the classification. Then they can ask some miscellaneous question. Where will you throw the blood bag? Where will you throw the urine bag? Very simple to remember. Lal mein peela, peele mein lal. Blood bag is of yellow color. Blood bag is red in color, so it goes in yellow. And urine bag, which is red in color, urine is usually yellow in color, so urine bag goes in red. है ना? Yellow in red, red in yellow. Okay. Where will you throw the prescription of doctors? They are garbage, so they will go in black. Where will you throw the vacuum-tainers? Vacuum-tainers are plastic vials, so they will also goes in red. Okay, where we collect the blood sample. So biomedical, again an important topic. The third important topic is international health, which was not so important earlier, but now they are asking the work of different organization. Like what is the work of SIDA Fund TB program? What is the work of DANIDA Fund I program? How to remember it? Very simple. We have double I, so D for double and I, so that is DANIDA, which goes in the I program. Then what does UNICEF fund? UNICEF fund maternal and child health. Okay. That's why in the logo of UNICEF you have mother and child together. Okay, they can ask what does UNDP fund? UNDP funds Sustainable Development Goal, main funder of Sustainable Development Goal. Then they can ask you about the recent thing also, like a COVAX initiative is there. Under COVAX initiative by WHO, WHO is asking all the developed country to donate some vaccine so that WHO can give those corona vaccine to African country. है ना? थोड़ा सा देना, है ना? WHO will ask for vaccine and then distribute it in African country. So this is one area of question. The second area of question they can ask you is the goal of Sustainable Development Goal. Very simple to remember. MMR has to be reduced to 70 per lakh. Okay. Neonatal mortality rate has to be reduced to 12 per thousand. Under 5 mortality rate has to be reduced to 25 per thousand. So just 3 numbers, 70, 12, 25, and you will remember it. Then accidental death is to be reduced by half by 2020, and premature cardiovascular death 1/3. So cardiovascular death 1/3 by 2030, and accidental death half by 2020. These are the Sustainable Development Goal target. Then they can ask you the head office of organizations by giving you image-based question from the logo. So do remember the head office. It is very simple to remember. 3 organizations, UNDP, UNFPA, and UNICEF, they are in New York. Okay. What is UNFPA fund? They have asked. UNFPA means United Nations Fund for Population Activity. What does it mean? Are they giving money for sex? Fund for population activity? They are trying to do the family planning program. So these 3, and a fund for population activity is for family planning program, remember it. And these 3 headquarters are in New York. So you just have to see their logo and you will remember it. When we talk about WHO, we all know it is in Geneva, and in the same place we have ILO, Red Cross, and UNAIDS. All of these are in Geneva. So like that you have to remember the head office and their logos. Okay. Then after international health, the 4th topic which is important is the epidemiological concepts. Okay. In the epidemiological concepts, they can ask you question regarding like secular trend. And all the cardiovascular disease are increasing in all the country. So cardiovascular disease are example of secular trend, and it is represented by line diagram. Okay, because there is a line of cases are increasing. Then the second concept question they can ask you from is the concept of lead time bias, which is important. The third concept which is important is iceberg phenomena, and there are 5 diseases in which there is no subclinical cases. Everyone will have some symptom at some time. So 5 diseases do not show iceberg phenomena, that you have to remember. Very simple. If you develop rabies, And suppose I being bitten by dog, my testis is being eaten by dog, suppose. And very painful, but suppose. So then if I develop rabies, I will start barking after some day. I cannot hide it. So iceberg phenomena is not shown by 5 disease in which patient can't hide it. They will develop the symptom. First is rabies, second is tetanus, third is measles, 4 is neonatal rubella, 5th is pertussis whooping cough. Okay, so they ask this question of iceberg phenomena. Then there are some small concept like what is tracking phenomena. Tracking phenomena means if BP is more at young age, it will remain high even at old age. Okay, like BP is tracking the person, it's like that. Okay, then they can ask they are asking the question from different types of epidemic. Okay, there are 3 types of epidemic: point source epidemic, like food poisoning in your hostel; continuous epidemic, like milkman distributing contaminated milk; and propagated epidemic, like flu, influenza, SARS, MERS, all are propagated. And propagated epidemic have secondary wave. Okay, then they can ask you what is the first step of outbreak investigation. The first step of outbreak investigation is confirmation of diagnosis. And in your hostel, suppose 4 or 5 of your friends started having churchery together. And churchery means loose motion. And this musical sound which come out in loose motion is churchery. So the first thing you have to do is take their sample for confirmation of diagnosis. Okay, so epidemics type they ask, and outbreak investigation first step they ask. Then the other concept they can ask from this is about PQLI and HDI. And please do not forget to read about global hunger index also, which has, in these two have three criteria. Global hunger index have 4 criteria. Okay, I hope you will revise it properly. Should I tell it here? First confusing thing is PQLI, the range is 0 to 100, HDI 0 to 1. PQLI, we have life expectancy at 1 year. First criteria. Then infant mortality rate, then literacy rate. So how, and here in HDI we have life expectancy at birth. So how to avoid the confusion here? PQLI is 4 letter, it is bigger, so the range is also bigger. HDI is 3 letter, smaller, so the range is also smaller. Second thing, in PQLI, it is itself written life expectancy at 1 year. See, L1, life expectancy is 1 is written. So that is the point to remember. In HDI, the 3 things: one is life expectancy in birth, then there is per capita income, and then there is mean year of schooling. Okay, these are the criteria. Then you should know about the mortality indicator mainly. Okay, what are the mortality indicator? First is standardized mortality rate, which is observed death by expected death into 100. Then they ask about case fatality rate, proportional mortality rate, and specific mortality rate. Okay, specific mortality rate. And it's very simple to remember all these 3 formula and definition. Case fatality rate very commonly asked in MCI exam. Case fatality rate, why they ask it? Because it tells about killing power of disease, killing power or virulence. Okay, in case fatality rate formula, the denominator have case and it is multiplied by 100. In proportional, the denominator have total death, it is also multiplied by 100. In a specific mortality rate, the denominator is population, and because population is big, so it is multiplied by 1000. And in all of these 3, the numerator is same. What is the numerator? Death due to specific disease. Okay, death due to specific disease. So same numerator here, same numerator here. So what does case fatality rate means? For example, in COVID, case fatality rate is 1 to 3%. That means if 100 case of COVID came, out of 100 case, 1 or 3 person will die. Okay, 1 to 3 will die. And they have asked the case fatality rate of rabies 2 years back, that is 100%. And 100 case, all will die. Okay, so these are the important questions from epidemiological concept. The 5th important topic for MCI exam is a very small topic of health planning and management, okay, from which usually one question comes from this four thing: cost benefit analysis, cost effectiveness analysis, system analysis, and network analysis. Okay, then they have asked question in past from Delphi method and also from work sampling. Okay, so let me quickly revise all this concept. Cost benefit simply means how much money you put, how much money you take out. That is cost benefit. Cost effectiveness means how much money you put, how many lives saved or quality of life you improve. That is cost effectiveness. And if you are comparing two or more doctors on the basis of how much extracurricular work they did, on the basis of their cost effectiveness, you are comparing two or more doctors or two or more program. That is system analysis. And this exact question came in MCI exam 3 exam back, that you are comparing doctor based on their extracurricular work. So that is system analysis, comparing two program or two person. In network analysis, we plan our time before taking action, and in it we have PERT and CPM. The best example of PERT is our mother preparing food in the kitchen. When she prepare food, she first put pulses or sambar, which take 4-5 CT in the cooker, and in the same time she prepare rice, vegetable and all other thing. So PERT means simply planning your time before taking action. Go tell it to your mother you are doing PERT, she will hit you, PERT, मेरे को सिखाएगा. CPM means critical pathway method. The work which take maximum time should be given first importance. The slow work should be given first importance. Like medicine and surgery are the bigger topics. So when you are preparing for MCI exam, do not do the mistake of leaving medicine and surgery. Do medicine and surgery in the first 2-3 months, so that you will be confident that I have done the bigger subject, and then that confidence will help you in retaining the things better. Because the more confident you are and happy with yourself, the better you can remember for longer time. Okay, so that is CPM. Delphi is a group method in which we take written idea from everyone, and then we forward the idea of one person to second, second to third, third to fourth, so that everyone can see each other idea and give their feedback. So that's a group method of collecting advices. Work sampling means we are comparing participant based on time taken to do specific work. Comparing based on time taken. And suppose you have to choose among two doctors, so you will choose that doctor who is taking less time in doing the same surgery. Okay, so that is time taken, work sampling, and these are the concepts of health planning management. Now the sixth topic which is important is the topic of environment. In environment, they can ask question from chlorination, which has 3 steps. In the first step, Horrocks apparatus is used to measure the chlorine demand of water. Then we put some bleaching powder, and in the second step, we give contact hour of contact period of 1 hour, in which hypochlorous ion kill maximum bacteria. This is the main chlorus. It has rus juice in it. So chlorus is the main killer. It kills 85% bacteria. Hypochlorite is not important. Chlorus. Contact period of 1 hour, second step. In the third step, the residual amount of chlorine is detected by chloroscope. And in the chloroscope, we have orthotoluidine and orthotoluidine arsenide test. And both of these tests, they detect both free and combined chlorine. This was the question in MCI exam 1.5 years back, that orthotoluidine detect only free or both free and combined. So detect both free and combined. Okay, OT or OTA, both will detect free and combined chlorine total. Okay, both free and combined chlorine. Okay, not just free or combined. What is the difference then between OT and OTA? The difference is, then in orthotoluidine, the color changes quickly. So free and combined chlorine cannot be detected separately. But in orthotoluidine arsenide, the color changes slowly. So free and combined chlorine concentration can be separately detected. Okay, then After chlorination and OTA, they ask question from fluoride, like the concentration of fluoride in water. They have asked in one of the exam, it is 0.5 to 0.8. For chlorine, the concentration is 0.5 to 0.7. So very simple to remember, 0.5, 0.7 here, 0.5, 0.8 here. The unit is milligram per liter. Okay. Then fluoride, they also ask that, they have given an image based question once, that if fluoride is more than 0.8, it can deposit on the teeth and it can cause white plaque, and that is known as dental fluorosis. That was the image based question that they have asked from here. And if the fluorine is less than 0.5, it can cause dental caries. So what you should do to prevent dental caries? Brush your teeth twice. And people who are in live-in relationship or married like me, they do brush it twice usually. But singles people should also do it, because you should be prepared. And it's a good habit. Brushing in night is more important than brushing in the morning. So how to remove excess fluorine? That is done by Nalgonda technique. Nalgonda technique, remove excess fluorine. And in Nalgonda technique, the mnemonic is lab. First we add lime, then we add alum, then we add bleaching powder to remove excess fluorine. Okay. Then they can ask about the air quality index, the pollution thing they can ask. Okay. They can ask about the greenhouse gas effect. They can ask about the Kyoto and Montreal protocol. Remember, Kyoto protocol is for greenhouse gas and Montreal protocol is for ozone layer protection, decrease chlorofluorocarbon protection to prevent ozone layer. Okay, decrease CFC production to protect ozone layer. So I used to think it like, kyun chhodi gas? Q, why emit gas? And so Kyoto is for gas, greenhouse gas. Montreal is for decreasing CFC production. Then they can ask question from this light and sound very rarely. In sound, they ask about sound limit. Remember, till 85 decibel it is okay. And 85 decibel is the cutoff limit for ear damage. And if it is 160 decibel, it can lead to rupture of tympanic membrane. They can ask question from light by unit of brightness, which is unit of brightness is candela, and unit of illuminance is lux. Okay. Then the safe limit of radiation exposure is 0.5 radon per second, and the thickness of lead apron is 0.5 mm. So two things are 0.5, safe limit and thickness. Then after this part of environment, the next topic which is important is the health programs of India. And in the health programs part, I have seen in last 6 years, mostly the questions they ask is from eye program very commonly, and then from malaria program. Okay. HIV and TB program are important, but not as important as eye and malaria program. Okay. TB and HIV program are also important, but not as important as eye malaria. Okay. Then they ask question from, in the HIV, they also ask question from color coded kit. And like kit 1 is gray color. And I hope you know, 1 is gray color, and gray color is used for 4 things. Gray is the most common color of the people in the world also. People are not, this is the famous line of my professor Bari ma'am. She used to say people are not in black or white shades, and they are in gray. Some good thing, some bad thing is in most of the people. So forgive yourself and forgive other for any mistake which you see. So gray is most common. What is the use of this mnemonic? You will remember gray is the first, because gray is most common color of the people and the world. Then you have green. Both are from G. To avoid this, I have given this mnemonic. Okay. This point, discuss this point, not mnemonic. In gray, there are 4 things we look. One is the cervical discharge. Second is the anorectal discharge. Third is the urethritis. They have asked it again and again. And urethral discharge. And the 4th is prostate inflammation. Okay, green is for vaginal discharge. Then after gray, green, kit 3, 4, 5 they ask. Very simple to remember. Just like WBC, it is WBR. W for white, in which you give penicillin. It is for why WBR the mnemonic? Because they all are for genital ulcer. White is for bacterial genital ulcer where you give penicillin. Blue is for those bacterial ulcer which are resistant to penicillin or allergic to penicillin. Many people are allergic, so here we give doxy. And red is treated by acyclovir because red is for herpetic ulcer. After this, the sixth is the most common category where we give yellow color kit. Remember, if a female comes, suppose I am a female and I come to your OPD with my backache or with inguinal area pain, that is the sign of PID. You will give yellow color kit for that. So PID is there. Along with that, if there is lower back pain, we also give yellow color kit. And the last is the black category where we give doxycycline for 21 day, 100 mg for twice a day for 21 day. And black is for inguinal buboes. Inguinal bubo means inguinal lymph node swelling. Okay, so can you remember it? Gray green, WBR, then yellow black. Okay, so very important area. This is the then from HIV they also ask about Suraksha clinic. Suraksha clinic is for STD patients. This Suraksha clinic is for all of these patients which we discussed. And the logo of Suraksha clinic look like logo of Red Cross, but it is not the same. It is like this. If I draw this thing, that is Red Cross. And this is Suraksha clinic logo. Okay. Now, in the health programs, the recent program we can read as a separate important topic. And when they ask question from recent program, they usually give logo of recent program, which is very important to discuss and remember. Okay, in the logo, do look at the logo of Niti Aayog, which has 4 tiger. Niti Aayog is for National Institute of Transforming India, and Niti Aayog formed by replacing Planning Commission. And these two questions have already been came. Planning Commission it replaced, and it is, what is the full form they have asked? National Institute for Transforming India. Then of course the most important is the logo of Ayushman Bharat, which has 5 leaf. And in Ayushman Bharat we have Pradhan Mantri Jan Arogya Yojana, which give, of course I hope you all know this, that it give 5 lakh rupees health insurance. Okay, health insurance only after the patient is admitted on a bed after hospitalization. And the question is it for BPL family or economically weaker section? It is for economically weaker section which are earning less than 10,000 per month. Okay, this is PMJ, and along with PMJ in Ayushman Bharat we also have health and wellness center. In health and wellness center, all the sub center and PHC will be changed into health and wellness center with 3 extra facility. 1 extra facility is of mental health. Second extra facility they will give is of ENT. But we don't have enough ENT and psychiatrist people in India already. So then the government opened the real card. We will give yoga. And yoga se hoga. Yoga will take care of other thing. Okay? Because the fund given in HWC is very small, so people are expecting only yoga, but still these are the 2 components of Ayushman Bharat. Please remember PMJ, Health and Wellness Center. Then the third program which is important is Lakshya program. Lakshya program has a logo of mother and child, and Lakshya is for improving maternal health facilities. Maternal health facilities are improved by Lakshya program. Then there are 2 new programs from which question can come. One is Suman. Suman stands for Surakshit Matritva Aswasan. Aswasan means assurance for safe motherhood. And under Suman you have one program is Lakshya. Suman is an umbrella program, and mainly Suman deal with zero denial to maternal health services. Okay, zero denial to mothers services. The second program under Suman is Janani Sishu Suraksha Yojana, in which we give 3 benefit: free ambulance, free drug, free treatment. The third program under it is Janani Suraksha Yojana, where money is given to mother and ASHA or USA for hospital delivery. The fourth program under Suman is Pradhan Mantri Surakshit Matritva Aswasan, which was the first program launched by the recent government, and they said free ANC checkup on 9th of every month. There will be free ANC checkup. Where? In government hospital. Okay, but the government forget to say one thing, that ANC checkup is free on every day of the month. So what the government is giving on 9th? Nothing. But they launched a new program on that. So this is on 9th free ANC checkup. Plus they said that if some gynecologist voluntarily without any payment want to do some ANC services, they can come to government hospital and do some ANC checkup. Okay. So these are the four main part: Lakshya, JSSY, JSY, PMSA, which is under Suman program. Other than that, in Suman, we also have a new program, that is Dakshata. Dakshata means skilled. So government is going to give training of a doctor and nurses for maternal health, for better maternal health, for delivery services. Okay, that is Dakshata. Okay, and if the program is NSSK, Navjat Sishu Suraksha Karyakram, there is again training. This is again training of doctor and nurses. Same training of doctor and nurses is there in NSSK, but this time it is for preventing neonatal death. Okay, if you prevent neonatal death, it is NSSK. If you prevent delivery related complication, that is Dakshata. Then the seventh program which is new is Kaya Kalp. Kaya Kalp is giving the guideline for cleanliness in public health facility. Okay, and they will also give prizes to the hospital which are maintaining good cleanliness. So cleanliness in public health facility. Okay, after Kaya Kalp, some new program are like Anmol. Anmol is software given to A&M for reporting of severely anemic female, or any complicated pregnancy can be reported by this software given to A&M. When the A&M heard this news that they are going to get the software for reporting of case, they asked one very good question: where is the hardware in which we put the software? But government has given the software, A&M will arrange the hardware. So that is Anmol. Then there is 3 other program related to mobile phone. One is Anmol, second is e-cessation. If you want to quit smoking, give a missed call on a number given by government. They will keep calling you so that you will leave your phone. It's not so easy to leave it, but still government is giving some guideline on phone to help you in quitting smoking. Okay, quitting smoking is not difficult. I already quit it 13th time, just 3 days back I quit it again. Now the 10th thing on this thing, or mobile related, app related thing which is government is giving is Kilkari. Kilkari is one program where how to keep care of the child health is given on the mobile phone. Okay, then the 11th program which is related to phone and new is 99 dots. There is some secret number hidden behind the wrapper of TB patient medicine. So when they are eating the drug, they will get the number and they have to send it to their ASHA or DOTS provider. So then if the DOT provider will get the message, they will know that they are taking it. If they will not get the message, they will try to make it sure that patient improve intake of TB drug. So 99 dots is to improve compliance to TB drug. Okay. Now, apart from this, apart from the Suman program, one new program which Government of India has started is Poshan Abhiyan. Poshan stand for Prime Minister overarching scheme for holistic nutrition. Holistic means complete nutrition. Under Poshan, first of all, we have Poshan Abhiyan. So how Poshan and Poshan Abhiyan is different? Poshan is an umbrella program in which 4 things come. But under Poshan Abhiyan, there is awareness campaign for 14 days. Okay. Then other than that, the second is PM portion. PM portion is just the renaming of midday meal. Now midday meal is no more, it is known as PM portion. Remember, in midday meal, half of protein and 1/3 calorie is given, because female do get the calorie from the rice, but they are not getting protein. So half protein, 1/3 calorie given not only to children between 1 to 12th class, but in PM portion they have added preschool children also. And how midday meal and PM portion different? Midday meal, 1 to 12th class children will get half protein, 1/3 calorie in lunch. PM portion, along with 1 to 12th class, preschool children, KG school children will also get the lunch. Okay. Apart from it, the third program in this umbrella is Nikchhay portion. I hope you all must be knowing. Nikchhay. Nik means no. Chay means loss of body. So loss of body occur in TB. So whenever you get Chay word, SHAY, it means it is related to TB. And Nikchhay portion means the government will give 500 rupees per month to TB patients. Okay, all the TB patient for nutritious food. Okay, and because if you divide 500 by 30, it will come roughly 18 rupees. So government is giving 18 rupees to all the TB patient for nutritious food. And what comes in 18 rupees? Small tea with a small gold fleck. But at least something is given, so it's a good thing. After Nikchhay portion, under portion, the fourth thing which is there is PM portion, Poshan Abhiyan, Nikchhay portion, and Anemia Mukt Bharat. Okay, so don't forget to remember the iron folic acid dose which we give in Anemia Mukt Bharat to different age group. Very important to remember. Okay, so my focus was that, okay, these are some of the recent health program which are very frequently asked. Always see the logo and then see these points which we have discussed. Okay, that is the 8th important topic. Then after this, in the 9th topic, they can ask you question from epidemiological studies. And if they ask you question from epidemiological studies, they mainly ask you to identify whether this study is case control or cohort. Identify the epidemiological study which are there. Okay, and I hope you can identify it easily. If it is case control, the two group will be disease present, disease absent. Disease and non-disease will be the two group in the beginning. If it is cohort, the two group will be exposed, non-exposed. So if they are starting with exposed, non-exposed, it is cohort. If they are starting disease, non-disease, it is case control. Okay. Okay. Then other than that, they can ask you about the definition of odds ratio, because odds ratio is also known as cross product ratio. So they can ask you the definition, which is odds of disease in exposed by odds of disease in non-exposed, and the formula is AD by BC. Then in cohort study, they can ask you about the definition of relative risk, attributable risk, and population attributable risk. The definition formula they can ask you to identify also. Then they can ask you the difference in case control and cohort. You have to remember the difference. Case control is easy to do for rare disease. Cohort is difficult to do for rare disease. Okay, so they ask the differences of these two, and these point they ask. Then you have to read the other studies also, but these two are very important, and they can ask you to identify the type of study. So you have to read epidemiological cross-sectional study also. Okay, because epidemiological studies is known as correlational study, which is done on population. So we are collecting hospital data and correlating it with population data. That is epidemiological study. Okay, suppose I said that cases of COVID increased in Tamil Nadu after election rally. So cases of COVID is a hospital data, and election rally is a population data. Okay, so whenever they are correlating these two, hospital data with population data, it becomes correlational study. Okay, Then you have to read cross-sectional study also, which is known as prevalence study, because in cross-sectional we see only at present moment what is the prevalence. And the second name of it is a snapshot study, because we can take picture only in the present. So that is why snapshot, prevalence, cross-sectional. So go through this study. Biases are rarely asked in MCI exam, so you need not to read about biases there much, but you can read about blinding in RCT. You can read about confounder and effect modifier, but mainly confounder and blinding you should read. Okay, RCT is also important to know. Now, after epidemiological studies, the 10th topic which you can see is important is biostat, but in biostat only image-based question from representation of data is coming in last 5 years. Only in one exam they have asked question from chi-square test. Other than that, representation of data, image-based question is what they are giving in all of the exam. So if you want to save time in PSM part, focus on representation of data from biostat part. Okay. So these are the 10 things. Now, apart from this 10, they can ask you the definitions of total fertility rate, general fertility rate, gross reproduction rate, net reproduction rate. And these are the 4 terms which are confusing and asked again and again. Very simple to remember. Total fertility rate means total child per female. Okay, total child per female between 15 year to 49 year. And TFR target of India is 2.1. If we want 2 child per couple, some will die, so the target is 2.1. GFR means again general fertility rate. It again means total child per female, but this time we multiply by 1000. So this is the difference between GFR and TFR. Okay, GRR means girl child per female, girl child per female. But we do not consider or we do not subtract those child who died. And girl child per female considering fertility rate. This question has directly been asked. Girl child per female considering fertility rate is GRR. Fertility rate means female will produce children between 15 to 49 year. This is the fertility trend. Not fertility rate, fertility trend. Okay. Did you understand it? Fertility trend means what is the current fertility trend? Current fertility trend is female produce children between 15 year to 49 year. So girl child per female, if they ask, considering fertility trend, answer will be GRR. But if they ask girl child per female considering mortality trend or considering mortality rate, that is NRR. Okay, considering mortality. If they use the word mortality, it become NRR. If they use the word fertility, it is GRR. But in GRR, NRR, both of it, only girl child per female is there. Okay, remember this question has came in MCI exam that if we want 2 child per couple, for 2 child per couple, net reproduction rate should be 1 and couple protection rate should be 60%. 60% eligible couple should be using contraceptive. Okay, so this is the 11th topic which is important, but very small point. The 12th topic is the nutrition, and from the nutrition they ask about the weight of reference male and female. The weight of reference male is 65, the weight of reference female is 55 now. Okay, second thing they ask from nutrition is that 350 kilocalorie extra is needed in pregnancy, 600 kilocalorie extra is needed in lactation. Okay, third thing they ask is the dose of calcium that we give. Remember, the dose of calcium is 1000 milligram for 3 group: adult male, adult female and pregnancy. 3 have 1000 milligram per day need of calcium. Okay, but If they ask about the calcium in pregnancy and old age, there it become 1200. Okay. Then they can ask you about the iodine in pregnancy. So in iodine in pregnancy is around 280 microgram in pregnancy. Okay. Then they can ask you a question from Kwashiorkor and marasmus. Okay, Kwashiorkor and marasmus is very important question. Remember, in Kwashiorkor the child will have protruded abdomen, and there will be, along with protruded abdomen, there will be fatty liver, there will be flag sign. Some hair will be brown, some will be white, so it look like flag is flowing on the head. Okay, Kwashiorkor child will be not interested in eating, and it will be not eating, he's doing all the time. And in Kwashiorkor there can be pitting edema, there can be swelling. When they ask Kwashiorkor, they have asked whether it is due to protein deficiency, energy deficiency, or both protein energy. Remember, Kwashiorkor is only protein deficiency, not protein plus energy. If it is protein plus energy, it becomes marasmus. Okay, just like Kwashiorkor and marasmus are protein energy malnutrition, similarly, if there is fatty acid deficiency, it will be phrynoderma, toad skin, rough black color skin in fatty acid deficiency. Okay, so these are some of the important area from nutrition. Do not forget to read about net protein utilization in marasmus, in nutrition part. Net protein utilization help us in assessing the quality of protein, and net protein utilization simply means nitrogen retained in the body by nitrogen present in the food into 100, and it is maximum for egg 96. That means if you eat some egg which give you some energy, the protein which is present in the egg is 100, and out of 100, 96 gram protein from egg our body will absorb. So that means very high absorption of protein occur from egg. That's why whenever you go to any gym, first thing they will start giving you is egg white. Because if you eat some egg which give you 100 gram protein, out of 100 gram, 96 is used by body. Okay, so these are some of the important area of question in nutrition. Then last topic but not the least is communicable, non-communicable disease. In non-communicable disease, you have to read how to measure malnutrition, like mid-arm circumference, weight for age, weight for height, weight for age, weight for height, and height for weight. Okay, then how to measure obesity you have to know, and then you have to know the criteria and cutoff for mental retardation, very important. You have to know what are the cancers which are most common, like the most common cancer in world, if they ask, that is breast cancer, not lung cancer. If they ask most common cancer in male of India, that is oral cavity cancer. All this data I am quoting directly from the recent edition of PARC. There is no doubt about it, this data. So you can ask this question that, sir, how come breast cancer is common? Why not lung cancer? The reason is, in breast cancer, patients suffer for 10-15 years, many a time, and they survive longer. So their name are in the register for longer time. So their burden is high. Whereas in lung cancer, patient die within 1-2 years. So the reporting of lung cancer is less than breast cancer. So breast cancer is most common worldwide. In India, oral cavity is most common. ऊंचे लोग ऊंची पसंद मानिक चंद बोलो तो बोलो जुबां केसरी है ना. Most common cause of cancer in male of India. Female, of course, breast cancer. And if they ask most common cancer in male of world, then the answer will be lung cancer. Okay, they are not saying Juba Kesari so common, hai na? So their lung cancer is more common. Now, after this, in communicable disease, which you have also read in microbiology, in pediatrics, they will give you image-based question. They will give you image of rashes of child with measles or chicken pox, or they will give image of diphtheria where there is pseudomembrane and bull's neck, hai na? So image-based question they will give to identify disease. For example, I have seen in 3 MCI exam, they gave honey-crusted lesion which occur in impetigo. Okay, so they will give the image and they will ask you to identify disease. Remember, measles rashes start from back of ear or back of hairline and then go on the surface, and measles rashes are merged with each other, fused with each other. They are not raised above skin surface, whereas chickenpox rashes are coming out from the skin surface like chicken beak. That's why they call it chicken pox. Okay, so you can separate chicken pox coming out, measles in the skin surface. Plus, in measles rashes child, there will be cough, cold, coryza, conjunctivitis. Water will be coming out from everywhere in measles. Okay, not in rubella or chicken pox. Okay, so do identify the images. Last thing they ask you is the incubation period and period of communicability, because incubation period is needed for quarantine and period of communicability is needed for isolation. Remember one more thing, in epidemiological concept they do ask about level of prevention, which is very important topic for your exam. So these all are the important topic for FMG exam. Do not go to your FMG exam without reading any of this topic which I have enlisted. I hope this session will be useful to you and you will be able to know something in a shorter way, crisp way. I tried to teach you some things also. So I hope this session is useful. Keep enjoying your life no matter whatever the situation is, and a situation will keep on becoming good or bad, and maintain a good high mode every time and enjoy your life, because we all can die any day, so do enjoy it. Keep rocking. Hasta la vista. Das vidania. If you have any doubt, any question, you can mail it to me on my email ID, or you can download the eGurukul app and you can ask the question there, or you can ask it on my phone number which is there. Okay, and remember, in my email ID it is DOC, not DOG. Okay, bye bye. Das vidania.